A doctor with Riverside Health saw his first COVID-19 patient almost exactly 1 year ago. Dr. Charles Phillips says he remembers it vividly, and he says there's still a lot more work to do to get out of this pandemic. Dana Smith sat down with him to take a look at what he's seen over the past year.
It's almost hard to believe, but it's been 1 year since the start of the coronavirus pandemic.
No, I had no idea that this would have taken off like it has.
Riverside Health System Dr. Charles Phillips saw his first COVID-19 patient back in March 2020.
It's kind of interesting, Dana. I walked in and the gentleman already had on. Now this is back at the very beginning now. He had already had a mask on. He had gloves on. And I looked at him, I'm like, why are you wearing all this?
And 5 days later, the first COVID-19 nasal swab test at his practice came back positive. From there, things only got worse. Dr. Phillips said just before Thanksgiving, Riverside averaged about 15 or 20 patients in the hospital at a time with COVID-19 infections.
And then, back in January, February, that went up to 120, which was ridiculous. It shot off the scale. And we're coming back down. We're not out yet. As of today, we're looking at 50 cases inpatient still, and that's still a lot higher than we were, before the big holidays.
Dr. Phillips said things aren't over with just yet. He said we have to be vigilant about the simple stuff.
Keeping your hands washed, wearing your mask, and stay socially distant. And we got to keep that up. You can't have a false sense saying, hey, everybody's getting these vaccines, we should be good. But we're not there yet. We're not even halfway there yet.
Wearing a face mask for safety is something that feels normal these days. And Dr. Phillips says this is something we're going to have to continue to do if we want to see severe cases of COVID-19 decline. In Norfolk, Dana Smith, 13 News Now.
And Dr. Phillips says the pandemic also hurt his bottom line. As cases increased, patients canceled his appointments. They didn't want to get sick in a hospital. But he says he adjusted by doing more virtual calls.